Want to know what is the most stubborn fat in your body that is hardest to lose? It is your visceral fat. It is the fat that is the most dangerous fat. I am Dr. Tahir and welcome back to Youthful Medicine. I'm a board certified obesity medicine doctor and I am going to share with you a patient story about stubborn visceral fat. Stick around to see what are the ways that we can reduce the stubborn fat even if it is resistant to your GLP medication. In this case, the patient is a 38 years old male who has been following me for about for the last 5 months. We started seeing in about May, and this patient has presented to us with quite a bit of challenges. First of all, the BMI is 38. He's a 36 years old male with a current BMI that he started out with me with 38. Now, the patient has been duly diligent in taking the medications. I'm not sure if he's doing enough for the diet because when I talked to him, he was in a driveway picking up his food. Interesting, right? Okay. So we're still dealing with a patient who has concerns that he is losing weight, but not the way that he would like to. Well, he started out with a weight of about 236, and on today's visit, his weight was 211. Now, this is great. He's making progress, but I feel like we have a little bit of a question here, which is he's currently on a Zepbound dose of 10 milligram. Now, what am I seeing here? The problem is his belly fat. He told me himself, he said, Doc, I am losing weight. I'm feeling great, but I am still not losing my belly fat. My fat here on the belly is pretty resistant. Well, what is it? It's visceral fat. Visceral fat tends to be the challenging fat in the body to lose. It is the most dangerous one. It is much easier to lose the subcutaneous fat. The fat on your belly and is the hardest, but on your arms, legs, other places, easier. But this visceral fat is the most dangerous one because it causes the metabolic derangement. And this is everybody's body is different. Metabolically, males have more tendency to put the weight on the visceral organs, internal organs. But after menopause, it happens in the women too. Here are some reasons why the visceral fat is stubborn, even with treatments with Zepbound or in Wegovy or whatever drug you. Hormonal factors. Visceral fat is more sensitive to the effects of the stress hormones like cortisol. Chronic stress can lead to increased fat storage in the abdominal area. Insulin resistance. Visceral fat is closely associated with higher levels of insulin resistance and metabolic syndrome. This type of the fat tends to respond less to insulin, leading to more fat storage, especially in people with prediabetes and diabetes. Inflammation. I deal with inflammation a lot. Visceral fat is metabolically active, releasing inflammatory markers like cytokines. That's why I see the numbers of C-reactive protein in my patients high all the time. This may interfere with the normal metabolic process and slow down of the fat melting or burning process. Lipid turnover. Lipid turnover is the visceral fat has a slower rate of lipid or the fat turnover compared to the fat deposits elsewhere in the body. That's why it is so hard to break down and use for energy. And that's where the problem arises. Now, best strategies to lose visceral fat. Number one, consistent calorie deficits. I am not judging on my patients, but I want to tell them, make a better decision. You are going to watch yourself. Cut back on your calories, at least 500 to 700 calories that you can decrease easily if you get rid of the processed food, if you get rid of the foods that are actually highly processed foods, highly simple carbs like breads and pastas, that kind of stuff. Strength training, resistance training can build muscle, increase your basal metabolic rate, and burn that stubborn visceral fat on your belly. And building muscles around the core and the larger muscle groups like the legs and the back can help reduce the visceral fat over time by improving the insulin sensitivity and increase the fat burning rate that you have. Another one, sometimes you might have heard about the high intensity interval training, HIIT workouts combined with short bursts of intense exercise with recovery periods can help improve your visceral fat. But don't get yourself hurt. Get yourself in better shape before you start hitting the gym with for the HIIT trainings or go to a high intensity exercise workouts like CrossFits. Diet composition: low carb, high protein, simple, easy, healthy fats. Healthy fats comes from your avocados, your nuts, oil, olive oil. Use them. Stay away from vegetable oils or processed fats. High fiber rich food that will bind the fat in your food and will help you. Fruits, veggies, whole grains. Remember, fruit, veggies, whole grains, and they will help you. Manage your stress. Taking too much stress and cortisol will increase your visceral stubborn fat. Improve your sleep. Monitor your gut health. I'll go deeper into these topics at a next video. Wanted to keep it concise and short for you. If you like this video, share it with someone, and see you in the next video. Stay youthful. See you next time.